dryness, irritation? Okay. One, this area down here. This lens, 2. Give these a try on. Hi, welcome to the clinic. I'm Dr. Charley, and I see you're here for your 5 o'clock appointment. Okay, great. Do you have any questions, particularly before we get set in? Okay. All right, so let's go ahead and get you checked in just briefly. I think we have most of your information, but we just want to confirm. Can you provide the spelling of your first name? Okay. That's a very beautiful first name. I love it. And how about your last name? Perfect. And date of birth? Okay, and you're all checked in, but before we get started, can you tell me if you are experiencing any discomfort or any kind of issues with your eyes currently? Okay. Any dryness, irritation? Okay. Redness or itchiness? Okay. And do you have any allergies? No. Okay. Okay, great. So you're all checked in. Now, as a matter of precaution, we are going to do a quick temperature check. This is standard procedure for all of our patients. So if you can just open up your mouth, I will put this under your tongue. Okay. Say ah. Okay. Okay, perfect. No fever. All right, so we can go ahead and get started with the exam. What we are going to do is a fairly detailed and thorough exam because it has been quite some time since you've been here. So we're going to start with dilating your pupils just a little bit. This really should cause you no discomfort, but we will dim the lights to make it a little bit more comfortable for you. Okay, the dilation will simply make your pupils larger and it will allow more light into your eyes so we can see a little bit more clearly and take some more clear photos of the internal parts of your eye. Okay? Okay, so we'll go ahead and dim the lights. Okay. All right, so we are going to put the dilating eye drops in, and this really should cause no pain at all. Just try to sit back and relax. I will be just gently holding up the upper lid of your eye so we can get the appropriate amount of eye drops in, okay? So just sit back and relax. Just gently hold up the upper lid of your eye. You can look up into the corner. That might help feel better. Okay. Once more on this eye. Perfect. Okay, now we'll do this other eye. Let me just hold this lid open a little bit, put your eye drops in. Okay, perfect. In really just a few seconds, you should start to feel your eyes dilating. Do let me know if you're feeling uncomfortable in any way. Typically our clients are just fine though. Okay, so the first thing that we're going to do in the exam today is I'm going to have you look into a camera, and you might detect that things are a little bit tinted in a different color, and this is so we can get a more accurate representation of what it is that you're seeing. Okay. All right, so if you can slide up a little bit forward on your seat, get your chin. I'll have you put it right here at the front of the machine. And we let me get everything together here. Okay, so set up toward the front of the machine, put your chin right here. Okay. And we're going to start now. Okay, you may notice that things are tinted just slightly red. That's perfectly normal. I'm going to have you look at a few pictures here. Can you tell me what shape it is that you're seeing? Okay, great. And how about in this one, this area down here? Can you tell me what shape it is that you're seeing? Perfect. Okay, we're going to try that a couple more times. If you can tell me what shape it is that you're seeing there on the top. Okay. And what shape are you seeing there on the bottom? Okay. Do you see spaces between the dots, or are the dots connected? Okay. Okay, perfect. All right, great. Keep looking through this. We're just going to cover a little bit of one side here to get a very good angle and detailed look into your eye. Okay, perfect. Okay, great. You can sit back now. Okay, fantastic. It looks like from that exam that you are seeing pretty clearly, and we're not experiencing any issues just yet, which is great. Okay, now I am going to need to get a little bit more of a detailed look into your eye, just a little bit closer. So what we're going to be doing now is to have you look through a small funnel, and we will just be kind of very gently with a soft Q-tip, just tapping your eye just ever so gently, and this is going to give us an idea of the kind of pressure that's behind your eye. Okay. All right. So we'll go ahead. Okay. This is going to be painless. Okay, very good. Very good. Okay, excellent. You can blink if you need to. We have a few more to do. Okay, great. Let's get it lined up here. Okay, perfect. Okay. Okay, great. Okay, you can close your eyes for a little bit to relax them. Okay. Okay, you did very well with that. Your pressure seems to be just fine. Okay, now we are going to just do a standard test to check your vision. So here, you will probably recognize this chart. We are going to have you identify some of the letters that you can see, okay? So we'll start with this top letter. Can you identify this? Very good. Can you see clearly on the second lines without squinting your eyes? Perfect. How about this third line? Very good. Okay, how about this line right here? Okay. Almost pretty good. We are going to need to cover one of your eyes because I think perhaps just one of your eyes is having a little bit of a difficulty. So I'm just going to cover one. Okay. Go ahead and read that same line. Great. Okay. Let's cover the other eye. Okay. Can you go ahead and read the same line? Okay, perfect. Okay, great. Can you do anything below that? This line, particularly down here. This is where a lot of people in our age group do have, start to have a little bit of trouble identifying the letters without squinting or without, covering one eye. Okay. really done a fairly good job. We might need to get you fitted for some glasses a little bit later. That's perfectly normal. You know, you've made it quite a long way without glasses, so nothing to be concerned about. Okay, great. All right. Now we are going to see which lens is more clear and which lens is more blurry for you. So I'm going to have you just use this eye right here, and we're going to put a lens over your eye and we will determine if this is clearer or blurrier, okay? Here is lens 1. Okay. And here is lens 2. Was lens 1 or lens 2 clearer? Okay, great. Try another one. Lens 3. Okay, or lens 4. Okay. Was lens 3 or 4 clearer? Okay. 2 or 3? Okay. 3. 1 or 3? Okay. Okay. We're narrowing down your prescription a little bit here. Now we're going to test your color vision a bit to see how you're doing. Typically, color blindness only occurs in males, but sometimes it does occur in females, so it's best that we just check to see how your color vision is doing at this time. Okay, can you tell me what number you see here in this first circle? 12. Good. Okay, and let's jump down to this one. Can you see this number? 3. Very good. Okay, let's go down to this one. It's a little bit harder. 42. Okay, let's go over to this one right here. Can you tell me what number this is? Okay, perfect. Great. 5. Okay, good. We'll just do a spot check. Sometimes they are a little bit more difficult, some are a little bit easier, but for these purposes, I think your color vision is fairly good. Okay. Now we need to check your peripheral vision. So I am going to have you follow this light while you are looking at my nose. So your vision must stay directly on my nose, and your face must be pointed toward my nose, but I need you to follow this just with your eyes, okay? Keep your head still. Just follow with your eyes. Very good. Okay, very good. Okay, good. Okay, now we're going to look a little bit more closely into your pupil. So we'll just run the light very quickly across. So open your eyes and look at me. Okay. Other eye. Okay, very good. All right. Let me take a few notes on what we've discovered today. Now we are going to do a simple test where I need you to tell me which hand is closer to you, okay? This will test your depth perception, okay? Okay, which hand? Good, this one, okay? Good, this one, okay? Okay. trick. They're about the same. Okay, very good. Your depth perception seems to be quite well. All right. Now, I think that your vision is pretty decent. And it looks like the condition of your eyes is fairly healthy. I do see just a little bit of dryness, so we may prescribe some eye drops for you in that regard. Okay. All right. Let me just check this part up here. Okay. Okay. During the day or when you're driving, do things at a distance look blurry to you? Okay. I mean, all in all, it is fairly good. But we just want to make sure we have everything completely accounted for, okay? Okay. Now, we are going to take this abacus, and I need for you to tell me how many beads are over at the at this side, okay? So you can see there is a set of red beads, and then on this part there is a set of white beads. Okay, so I just need for you to tell me how many have been pushed over to this side. Can you see that clearly? 3. Very good. Okay. We'll try a little bit more. Okay, can you count these? Yes, there are 9. Very good. Okay. Okay. That seems to be fairly decent. Okay. Now, we're going to put this card basically right in the center of your eyes, okay? And I want for you to tell me which side of the card you are seeing something appear in your field of vision, okay? This one? Okay. Okay. We'll do it again. Same side. Good. Good. Okay, great. That seems to be just fine. Okay, so close your eyes, please, for me. I'm just going to wipe off a little bit of the eye drops. Okay. And you are going to need some glasses, so what we're going to do is take some brief measurements so we can make sure that we get the glasses that are appropriate for your face shape, your face size, and that are really going to work with you, okay? So this process shouldn't take too long, but you probably will just want to sit back and relax. You do need to be as still as possible so I can get the accurate measurements. We'll be measuring everything eye width, nose to the edge of your temple over here, nose to this temple, some diagonals, eyebrows. There's a lot of details that go into this, so we can make sure that your glasses fit you very, very comfortably, and so that you don't have any problems later on, okay? So just sit back and relax. I'm going to need to be looking at some numbers from this measuring tape, okay? Let's see. Full face from side to side here. Okay, and it looks like 8.1. Need to go here to the nose. Looks like 3.3 on this side, and we have got 3.13 this diagonal. Okay, 4.1, go all the way across. Okay, is that right? That's not what I was expecting. Let's do this side. Okay, we've got to do that one again. Okay, hold really still for me. We're having just a small discrepancy, so I want to make sure that we get the most accurate reading, okay? And if you can, relax your eyebrows for me, relax your brows, relax your temples. Sometimes when they're a little bit tense, it can make the measurements just a little bit off, okay? So I just need you to relax everything, okay? All right, let's do it. Okay, hold very still. Okay, 6.2. That makes a little bit more sense. We gotta get back on this side. Okay, 6.35. I'm gonna go up here. Okay, 5.25. Just the eye itself. 1.7. This one. Okay, 1.72. This width over here. 1.8. This one is 1.89. Okay, now I'm going to have you actually close your eyes for me. Just need to get a measurement from the top of your eyebrow to your lower lid line, but your eyes do need to be closed. Okay, thank you. Okay, we are measuring at 3.2. This one, let's see, we are measuring at 3.35. Okay. Now I need to get from the inner corners to the outer corners, so please close your eyes again. Okay. I'm going to start right over here. 2.2. Okay, and this one. Okay, we're going 2.26. Okay. Right now we need to get the bridge of your nose so that we can get the pads on your glasses to be the appropriate width for you. Okay. 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 Okay, 2.24. Okay. What shape of glasses do you prefer? Would you like something more rounded? Like that, really circles your eyes? Or would you want something that's a little bit more flat? Flat on the bottom and flat on the top. Or you could even do, with your face shape, you could do sort of like an octagonal, or maybe more of a trapezoid type shape. Okay. And do you prefer to have a larger lens, or do you prefer a slightly smaller lens? Okay. Okay. Let me just double check a few measurements here. Okay. 8. Get this. Okay. 14.26. Okay. We do need to make sure this one is extremely accurate. Okay, 4.623. Over here we have 4.624. Okay, you are showing to have quite a symmetrical, almost exactly, not quite, but no one has it exactly, quite a symmetrical face shape, which will make fitting your glasses quite a bit simpler, okay? So I'm happy to hear that. For your glasses, do you prefer that the nose pads are the adjustable soft kind that kind of can, have a little bit of buoyancy on your nose, or do you prefer the ones that are built into the glasses that are hard and plastic? Okay, Yeah, I agree. I think that the softer adjustable nose pads are good, and it's going to give you a little bit more wiggle room throughout the day. Sometimes, if you have too many salty foods or something, you can experience just a little bit of swelling, and then you can adjust them so that everything will be very comfortable for you. Okay, so I do have a pair of glasses. I'm going to clean them first. That I think might just be the absolute best fit for you. So let me just clean them, and then I'll show them to you. Now we want to make sure that everything fits perfectly because our main goal is to ensure your comfort. Make sure these are clean. And these are a beautiful, very, very almost not noticeable light green color. And I think that will complement your eye color quite well. Okay. So these are the lenses, and you can see they have a little bit of a trapezoid shape. They do have the nose pads, the adjustable comfort fit nose pads that you expressed as your preference. So let's give these a try on. Okay, and what are your thoughts on these? Do they feel comfortable? Okay, yeah, we can adjust that just a little bit there. Okay. Get it down a little bit. Perfect. They're really lining up with your eyebrows quite nicely. Okay, great. I think these are going to be wonderful for you. Just put them in this case. So we will give you this case with your glasses that you can take home. And you can always come see us again if you're having any trouble. It is, please note that, over the first week or so, your eyes will be adjusting to your new prescription, and you might feel, a little bit of discomfort, a little bit of difficulty just getting used to them. Give it about a week or so. If you're experiencing any kind of problems at all, though, I want you to come back and see me right away, and we can resolve whatever kind of issue it is that you're having. Okay. Now, since we did dilate your eyes, we are going to need to put some additional drops in them to help them go back to look up the right way. Okay. And let's just have you look at me real quick. Let me see how dilated your pupils are still. Okay. Fabulous. They're getting much smaller. Things are looking much, much better. Just see. Okay. Can you see me clearly now? Do your eyes still feel sensitive to the light? Okay. Okay, great. Okay, let's just do one more check. Okay, please look straight ahead at me. Okay, I'm going to check the top. Okay, this other part here. Okay, great. Okay. Okay, I think you are ready to go. We have noted your prescription strength within our system, and just keep us posted if you do have any questions. Okay. Thanks for coming to see us. Bye.